Hey there, foodies and health enthusiasts. Today, we're diving into a topic that's both eye-opening and a little scary: the impact of ultra-processed foods on our health. Now, you might be wondering, what exactly are these ultra-processed foods? Well, picture this: think of those boxed and wrapped snacks, ready-to-eat meals, and all those colorful, plastic-packaged treats lining your grocery store aisles. These are the ultra-processed foods we're talking about. And guess what? They're everywhere, making up a staggering 50% of our daily calories and a whopping 60% of our kids' diets. Now, that's a lot of food to process. But here's the kicker: our bodies weren't designed to handle this kind of food. At least, that's what David Kessler, the former FDA commissioner, is telling us. Kessler, who made waves by exposing the tobacco industry's tricks, is now turning his attention to the food industry. In his words, over the last 40 years, the United States has been exposed to something that our biology was never intended to handle. He's talking about ultra-processed foods, which are energy-dense, highly palatable, and rapidly absorbable. These foods have altered our metabolism and led to a surge in chronic diseases like type 2 diabetes, prediabetes, hypertension, and more. Now, you might be thinking, but aren't these foods just convenient? Well, Kessler argues that the scale of this issue is as large, if not larger, than the tobacco crisis. And here's the thing: it affects everyone. Whether you smoke or not, the number of people consuming ultra-processed foods is staggering. So, what's the solution? Kessler and Health and Human Services Secretary Robert F. Kennedy Jr. have found common ground in a government classification called GRAS, generally recognized as safe. This classification allows food companies to use ingredients without a full government safety review. Kennedy and Kessler argue that this has led to the proliferation of ultra-processed foods, which are low in nutrition and high in calories. Kennedy, who issued new dietary guidelines advising against highly processed foods, believes that the GRAS exemption has been hijacked by the industry. He wants to close this loophole, which has allowed thousands of new ingredients to be added to our food supply without proper oversight. Now, you might be thinking, but what about the food deserts and the people who can't afford healthy food? Kennedy has a plan for that too. He wants to make sure that all foods are affordable and accessible to every American. But here's the catch: Kennedy's credibility on this issue has been called into question due to his history of vaccine skepticism. Despite this, Kessler is hopeful that Kennedy will take action on ultra-processed foods. After all, it's not just about trust, it's about public health. So, what's the takeaway? Well, it's time to pay attention to what we're eating. Ultra-processed foods might be convenient, but they're not doing our bodies any favors. And maybe, just maybe, it's time to reevaluate our food choices and support initiatives that promote healthier, more nutritious options. So, what do you think? Are you ready to take on the ultra-processed food challenge?